When I was first diagnosed with PD, I had 100 questions spinning around in my head. I was thinking, why me? How long have I got? Can I still work? Who do I need to tell about this? Is it normal to have these feelings of confusion and anxiety when you're first diagnosed?
Yeah, so I guess the first thing to say is that it's completely normal to have those sorts of feelings. And people actually describe a whole host of different types of emotions. Some people feel very anxious, very worried, whereas other people can actually even feel relief. Sometimes people say things like, I'm glad it wasn't anything worse. I think that these emotions can change day to day. So there's not just one way that you're going to feel after diagnosis. It's like any sort of major transition or event in your life. You have lots of different feelings. They change one day to the next, and all of the feelings are completely normal.
I can certainly relate to that feeling of relief because I'd had symptoms for a couple of years and they were quite disparate things and quite confusing, and suddenly it all fell into place when I had the diagnosis. So the initial reaction is one of shock, and you start thinking, I guess, all the negative thoughts or the worst case scenarios. But actually you start to realise that PD isn't as bad as some things you can get. Have you got any tips for sort of having that more positive thinking?
There's no quick way to get to that point. Sometimes it just takes time to get there. Others find it really useful to talk about their emotions with friends and family, maybe to talk to other people that have had the diagnosis of, trying to understand how they've navigated that diagnosis, what they found to be helpful. What does Parkinson's mean for you? Because sometimes you have that idea in your head of what is Parkinson's. So is it a grandfather who had it, who was very tremulous and unwell with it? Or is it actually someone who's young and able and is living a really good life with Parkinson's? People have these images in their head and they have to sort of try to figure out where they are on that sort of spectrum of and trying to see what's the best life that they can have with Parkinson's. The most important thing is to just give yourself time to adjust, to figure out where to get good information and support, and to talk to other people about how you feel.
So a couple of things that helped me in the early days was, number one is I wrote down a list of all the questions and all the things in my mind to sort of get control of that confusion. And the second thing is, after a few months, I sought out a support group. So I looked up on the internet, on Parkinson's UK and other websites, what local groups there were. And I found a local group that met once a month on a Saturday morning. And that was really useful. Initially, actually, it was a bit of a shock because you start to see people in the more advanced stages of the disease. So that's a sort of a wake-up call as to how it can progress. But it was also very useful as well, just to relate to people who've been through the same journey.
It sounds like you were really proactive about the way that you were going to manage your diagnosis.
Yes, I mean, there's a lot of resources out there on the internet, of course, and a lot of online forums. I think you have to be slightly careful of those because they can focus a lot on the negatives as well as the positives. And so you don't want to get a biased view. What are some of the things you've observed about how people start to take back control?
There are lots that you can do to pull things back under your control. The best thing that you can do for your Parkinson's, for your mental health, is exercise. We know that this is better than any medication the doctors can give you, better than any surgery technique, and it's completely free. It's available now, and it's entirely within your control. So we know that exercise can actually hold back the progression of symptoms in a way in which nothing else can. Nothing else we have been able to show can hold back the progression of symptoms.
It becomes a sort of a vicious circle of you feel a bit down and you don't exercise and then you feel worse. Have you got any ideas about how to snap out of that vicious circle?
Apathy tends to come along with either feeling low or feeling anxious. So people can sort of avoid doing things because they feel down and they don't want to go out, or maybe it's because they feel anxious and they feel worried about doing things. And so really anything that's going to improve low mood or anxiety is also going to improve your desire to do things. What I find is that people with Parkinson's who don't have a lot of energy to do things can often save up all their energy to then sort of spend it on housework or admin. And actually they find themselves sort of spending the day doing hardly any pleasurable activities. And so if that's the case, then of course then their desire to do things is going to gradually reduce.
Mental health issues like anxiety and depression can be a significant challenge with Parkinson's. Regular exercise can be very beneficial in improving mental health. Watch out for early warning signs like changes in behaviour and consult a medical professional if you have concerns.
If you're interested in finding out more about Parkinson's, subscribe for a new video every Thursday.